If you're over 60 and noticing memory lapses, confusion, or slower thinking, it may not just be aging. The truth is, your prescription medication could be silently interfering with your brain day after day. Recent studies reveal that certain common drugs, especially when taken long-term, are linked to a higher risk of dementia, brain fog, or rapid cognitive decline in older adults. This is deeply concerning because many of these medications are not rare or specialized. They're the everyday pills prescribed for things like seasonal allergies, sleep troubles, anxiety, or even bladder issues. Doctors often prescribe them with good intentions, but few seniors are warned about the potential impact these drugs may have on memory and brain health. The danger lies in how these medications affect chemical messengers in the brain, sometimes reducing the very signals your brain needs to stay sharp and focused. In this guide, we'll uncover the 9 most concerning medications tied to cognitive decline in seniors, and what safer alternatives you can discuss with your doctor. 1. Diphenhydramine, Benadryl. Many seniors reach for Benadryl to ease allergy symptoms or even to help with sleep. But what seems harmless can quietly harm the brain over time. Diphenhydramine is classified as an anticholinergic, meaning it blocks acetylcholine, one of the most important neurotransmitters your brain relies on for memory, learning, and focus. When acetylcholine levels are reduced, the brain's ability to form new memories and recall information weakens. Research shows that regular or long-term use of anticholinergic drugs like diphenhydramine can significantly increase the risk of dementia and cognitive decline in older adults. Even occasional use as a nighttime sleep aid can create brain fog the next morning, leaving you feeling groggy, unsteady, and less alert. What to do instead? Talk with your doctor about non-anticholinergic allergy medications that are safer for seniors. Avoid relying on Benadryl as a sleep solution. It was never designed for that purpose. Consider natural alternatives for better rest, such as tart cherry juice, magnesium supplements, calming bedtime teas, or gentle breathing exercises. Protecting your memory and mental clarity is about making small, smarter choices. Avoiding medications that rob your brain of key neurotransmitters is one of the most powerful steps you can take. And speaking of sleep, another major category of drugs that quietly erode brain health are prescription sleeping pills. Let's take a closer look at the hidden risks of it. 2. Sleep medications, zolpidem, ezopiclone, temazepam. For many seniors, a prescription sleeping pill feels like a quick fix for restless nights. Names like Ambien, Zolpidem, Lunesta, Esopiclone, and Restoril, temazepam are widely prescribed to help people fall asleep faster and stay asleep longer. But what most don't realize is the hidden toll these drugs take on the brain. These medications can cause lingering drowsiness, impaired coordination, and slower reaction times, effects that don't stop once the morning alarm rings. This not only raises the risk of falls and accidents, but also quietly chips away at mental clarity. Even more concerning, studies show that long-term use of these drugs is linked to brain shrinkage and a higher risk of dementia in older adults. Instead of restoring healthy sleep, they may disrupt the brain's natural sleep cycles, preventing the deep restorative rest your memory and cognition depend on. What to do instead? Use these medications only short-term and only when absolutely necessary. Build strong sleep hygiene habits. Keep a regular bedtime, avoid screens at night, and keep your bedroom dark and cool. Ask your doctor about safer options such as melatonin, magnesium, or non-drug therapies like relaxation techniques. Sleep is vital, but not at the cost of your brain. And while sleeping pills are risky, there's another category of drugs that is even more alarming for seniors. 3. Benzodiazepines, diazepam, lorazepam, alprazolam. Drugs like Valium, diazepam, Ativan, lorazepam, and Xanax, alprazolam, are commonly prescribed to ease anxiety, panic attacks, or insomnia. While they may bring short-term relief, the long-term effects on the brain can be devastating, especially for seniors. Benzodiazepines work by slowing brain activity, which can reduce anxiety in the moment. But with continued use, this slowing effect doesn't just calm nerves, it also clouds thinking, reduces attention span, and interferes with memory. Research links prolonged benzodiazepine use to increased risk of dementia, persistent confusion, and impaired motor skills. Even worse, these drugs are sedatives, meaning they increase the chance of dizziness and falls, a serious danger for older adults that can lead to broken bones or hospitalization. Dependence can also develop quickly, making it harder to stop once started. What to do instead? If prescribed, use them short-term only and only when absolutely necessary. Explore non-drug strategies such as therapy, mindfulness practices, deep breathing, or light daily exercise like walking, which can naturally reduce anxiety. Talk to your doctor about safer medication alternatives that don't carry the same long-term cognitive risks. Protecting your mental sharpness means weighing the risks carefully. And while benzodiazepines are a major concern, another class of drugs used for an everyday issue, overactive bladder, may be even more damaging to memory. 4. Anticholinergic bladder medications, oxybutynin, tolterodine. For many seniors, bladder issues like urgency, leakage, or overactive bladder can feel embarrassing and disruptive to daily life. Medications such as oxybutynin and tolterodine are often prescribed to calm the bladder muscles, making symptoms easier to manage. But what many don't realize is that these drugs belong to a class called anticholinergics, which block acetylcholine, the same vital neurotransmitter that supports memory, focus, and overall brain function. The result? While your bladder may become calmer, your brain may become foggier. Research has shown that seniors taking these medications long-term face a significantly higher risk of memory loss, confusion, and even rapid cognitive decline. The brain struggles when its chemical messengers are disrupted, and for older adults, this impact can be profound and long-lasting. This creates a painful trade-off: fewer bladder accidents, but a weaker, less reliable memory. For seniors who value independence, this cost is simply too high. What to do instead? Ask your doctor about non-drug strategies, such as bladder training or scheduled bathroom breaks. Strengthen your bladder with pelvic floor exercises and avoid irritants like caffeine or alcohol. Explore newer bladder medications that are designed with fewer side effects on the brain. Your independence and clarity of mind are worth protecting, and if bladder medications are concerning, wait until you hear about the next group: powerful drugs that can alter brain chemistry even more. Have you or a loved one noticed brain fog with these medications? Comment below, share this with someone who needs it, and don't forget to subscribe for more senior health tips. 5. Antipsychotics, quetiapine, risperidone, haloperidol. Antipsychotic medications such as quetiapine, Seroquel, risperidone, Risperdal, and haloperidol, Haldol, were originally developed to treat conditions like schizophrenia or severe mood disorders. However, in seniors, these drugs are sometimes prescribed off-label for behavioral issues, sleep problems, or dementia-related agitation. While the intention may be to provide relief, the risks often outweigh the benefits. Studies show that antipsychotics can worsen confusion, impair memory, and increase the likelihood of falls in older adults. Even more concerning, their use has been linked to a higher risk of stroke and even premature death in seniors with dementia. This makes them especially dangerous when used as chemical restraints, a way to control difficult behaviors without addressing the root cause. For caregivers and seniors alike, it's important to understand that while these drugs may appear to calm agitation, they can come at the steep cost of clarity, safety, and overall health. What to do instead? Use antipsychotics only under careful medical supervision and only if absolutely necessary. Explore behavioral therapies, structured routines, or environment-based calming techniques to address agitation naturally. Seek professional advice on safer, individualized alternatives before considering these high-risk drugs. Protecting brain health means looking beyond quick fixes, and while antipsychotics carry serious risks, another older class of antidepressants, still prescribed to many seniors, can also silently damage memory and thinking. Next, we'll uncover the hidden dangers of it. 6. Tricyclic antidepressants, amitriptyline, nortriptyline. Before newer medications were developed, tricyclic antidepressants, TCAs, like amitriptyline and nortriptyline, were widely prescribed for depression, anxiety, and even chronic pain or migraines. While they can be effective, they come with a hidden cost for seniors: strong anticholinergic effects that interfere with the brain's ability to process and store information. These drugs block acetylcholine, a neurotransmitter critical for memory, focus, and alertness. As a result, seniors taking TCAs may experience confusion, blurred vision, dizziness, difficulty concentrating, and short-term memory problems. The risk grows with long-term use, creating a slow but steady decline in mental sharpness. For older adults already vulnerable to falls and cognitive decline, the side effects of TCAs can make everyday tasks more difficult and independence harder to maintain. While they may be prescribed out of habit, safer alternatives now exist that don't carry the same heavy burden on brain health. What to do instead? Ask your doctor about newer antidepressants, such as SSRIs, which tend to have fewer cognitive side effects. Monitor closely for any changes in memory, focus, or alertness while on medication. Support mental health naturally through therapy, regular exercise, social engagement, and good sleep habits. When it comes to protecting memory, replacing outdated drugs with safer options is a powerful step. But antidepressants aren't the only concern. Another class of medications used for seizures and nerve pain also poses risks. 7. Anticonvulsants, phenytoin, carbamazepine, gabapentin. Medications like phenytoin, carbamazepine, and gabapentin are often prescribed not only for seizures, but also for nerve pain, restless legs, and even mood stabilization. While they can provide much-needed relief, they also carry significant risks for seniors. One of the most common side effects is drowsiness and slowed reaction time, which can make everyday activities more dangerous. Beyond that, these drugs may affect the brain's ability to process information quickly, leading to slowed thinking, reduced concentration, and memory lapses. In seniors, this can mimic or worsen early signs of dementia, making it harder to distinguish between normal aging and drug-related side effects. Another concern is balance. Anticonvulsants can interfere with coordination, increasing the risk of falls and injuries, which are already a major health threat in older adults. The combination of mental fog and physical instability can quietly chip away at independence over time. What to do instead? Always use the lowest effective dose to minimize side effects. Closely monitor for any changes in memory, focus, or balance. Schedule regular reviews with a neurologist or prescribing physician to ensure the medication is still necessary and safe. While anticonvulsants serve important purposes, they highlight the delicate balance between treatment and brain health in older age. And speaking of delicate balance, one of the most widely prescribed heart medications has also been linked to memory problems. 8. Statins, some types, e.g., simvastatin, atorvastatin. Statins are among the most commonly prescribed medications worldwide, often given to seniors to help lower cholesterol and reduce the risk of heart attack or stroke. While their heart protective benefits are well documented, concerns have been raised about their possible impact on brain health. Some seniors report experiencing memory loss, confusion, or mental fog while taking certain statins, particularly at higher doses or with long-term use. Research in this area remains mixed. Some studies suggest a link between statins and cognitive problems, while others argue the benefits for heart health outweigh the risks. Still, the personal experiences of many older adults make it worth paying close attention. Not all statins are the same. Some types, like simvastatin and atorvastatin, may be more likely to cross the blood-brain barrier and potentially interfere with memory. Others appear to have less impact on cognitive function. The key is individualized care, making sure you and your doctor weigh the pros and cons based on your unique health profile. What to do instead? Discuss the benefits versus risks of your specific statin with your doctor. Ask about alternative statins or lower doses with fewer brain-related side effects. Support brain health naturally with omega-3s, regular exercise, quality sleep, and a balanced diet. Statins may protect your heart, but they can also cloud your mind, and they're not the only culprits. Another category of seizure and mood medications raises even more concern. 9. Antiepileptics, mood stabilizers, valproate, topiramate. Medications such as valproate and topiramate are often prescribed to treat conditions like seizures, migraines, or bipolar disorder. While they can be highly effective in controlling these health challenges, they also come with a cost, particularly for older adults. These drugs are known to interfere with brain function in ways that can be subtle at first, but become increasingly noticeable over time. Seniors taking antiepileptics or mood stabilizers may experience slowed thinking, difficulty concentrating, word-finding problems, and memory lapses. In some cases, they may even notice changes in speech patterns or trouble recalling everyday information. Because the brain naturally becomes more sensitive with age, older adults are especially vulnerable to these side effects. The result can be a reduced ability to focus, participate in conversations, or maintain independence in daily life. For seniors already at risk of cognitive decline, these drugs can intensify the problem. What to do instead? Take these medications only under close medical supervision and never adjust the dose without guidance. Track and report any new memory, speech, or concentration problems to your doctor right away. Ask about non-drug approaches for migraine relief, like stress management, hydration, and sleep routines, or mood stabilization, such as therapy, exercise, and social connection. While these medications can be life-saving, their impact on the brain should never be ignored. Protecting memory and mental clarity is just as important as treating the condition itself. If you're over 60, your brain is more sensitive to medications than ever before. Some pills may be treating one condition while quietly stealing away your memory, clarity, and focus. What feels like just getting older could actually be a side effect of the medications in your cabinet. To recap, here are 9 medications linked to rapid cognitive decline in seniors: diphenhydramine, Benadryl; sleep medications, Ambien, Lunesta, Restoril; benzodiazepines, Xanax, Ativan; bladder meds, oxybutynin, Detrol; antipsychotics, Seroquel, Risperdal; tricyclic antidepressants, amitriptyline; anticonvulsants, gabapentin; statins, simvastatin; mood stabilizers, topiramate, valproate. The important takeaway? Don't stop any medication suddenly. Instead, review your prescriptions and over-the-counter drugs with your doctor. Bring a written list and ask a simple but powerful question. Could this be affecting my memory or mental sharpness? There are often safer alternatives, lifestyle strategies, or lower doses that can help you stay healthy without sacrificing brain power. Protecting your mind is just as vital as protecting your heart, bones, or blood pressure. If this article helped you, Please share it with someone over 60 who takes multiple medications. It could save their memory. And comment below, have you experienced brain fog or forgetfulness that might be linked to your meds? Stay tuned for more senior health tips designed to keep you sharp, strong, and independent naturally.